Probably don't remember me, but we met for about 5 minutes when you evaluated me within 5 minutes and signed off on a diagnosis of psychosis of me, delusional disorder, erotomania, and that was all that we saw each other for, was that 5 minutes. But I went to court after my 10 days at ECMC. I was released. I was never on medication. I've never been on medication before that. I have never been on medication since. My circumstances don't need to be conveyed here as they're not very pertinent to it. But the comment, Dr. Bakhai, that you made, I teach my medical students to ignore some of the legal issues because I've worked for 30 years and I've never been sued. I actually did sue you. I tried to sue you about a year after my incarceration at ECMC. And my lawsuit was thrown out by Judge Emilio Colvicchio on grounds that I had missed a deadline. So I'm sure that there are people who do sue doctors at psychiatric institutions, but institutionally we're kind of stumble sometimes in doing that. So my question, the larger questions that I have are about issues of who controls the narrative. I appreciate the panel that we have, especially Maura and Anne, both of your perspectives. I do feel like you bring more of a patient's rights perspective to the table, and I appreciate that this event included diversity of voices in that way. One of the things I would raise is that perhaps it was not that she was released so much that was the problem, as much as there wasn't a plan in place or resources available for her to be released, and because that's what she wanted, so that she could have the voice and say, I don't want to be medicated, I want to be released, but also have the resources that wouldn't be taken away immediately upon her rejection of medication and incarceration. Thank you.
So I'm just going to let the panel respond to that as you